Mr. Arisandy. He is a physiotherapy practitioner and physiotherapy lecturer at the Physiotherapy Undergraduate Study Program at the Institusi Teknologi Kesihatan dan Sains Wiata Husada Samarinda, East Kalimantan. He is an expert who deals with internal organ dysfunctions, has directly handled dozens of cases of internal disease since 2006, and one of it is functional dyspepsia. He has been active as keynote speakers for manual skills competency at Indonesia since 2010. And he is also the author of best-selling physiotherapy book in Indonesia. Welcome, Mr. Arisandy, and the platform is yours.
Thank you very much, Dr. Ida, and all the IT team in UITM. And I hope my presentation can inspire you in the future to see new competency and the physiotherapy related to visceral problem. Okay, can you hear my voice? It's clear or not?
Yes, we can hear your voice loud and clear.
Okay, thank you. I want to start to share my slide. Okay. Okay. This method, can you see this slide?
Yes, we can.
Okay. Assalamualaikum warahmatullahi wabarakatuh, my sister and my brother. Today I will presentation about visceral manipulation physiotherapy for the patient with functional dyspepsia. We know, I think the visceral manipulation not familiar for the too much physiotherapy, but inshallah, this after presentation, I have physiotherapy can give the inspiration in the future to see now the new competency in physiotherapy related to the visceral problem. Because the visceral problem too much and very little the new few the physiotherapists to handling the visceral problem, and this one how is visceral manipulation physiotherapy to handling patient with functional dyspepsia. Functional dyspepsia in my country is called Yerigma. I don't know in the Malaysia country what it is called for functional dyspepsia. But in my country is the sakit mah, like that. Okay. The functional dyspepsia in review. I will do presentation pathophysiology and challenge in the intervention of visceral manipulation physiotherapy. TFT is the one of the most common gastroduodenal or stomach disorder in the general population adults with a high prevalence worldwide, and the increased cost was nearly $80.4 billion in United States in the 2009, with more taken in women, 20.8% versus 20.9% in men. In the United States of America, the prevalence of FD is approximately 40 to 50%, and the Western country up to 40% of the population, and the Asian country increased up to 50%, and Indonesia also, the prevalence of FD is estimated at 50%. So, how is functional dyspepsia defined? According to Roma 4, the criteria, FD is the most common disorder of the upper gastrointestinal tract, defined as the presence of the postvaginal fullness and epigastric pain and the absence of organic disease to explain the patient's symptoms. Occur for the last 2 months with an onset of at least 6 months in advance. So, what we do now to the pathology of FD? The pathology of FD, sometimes the problem from is the gastric motility. It's number one. Studies have reported the gastric motility abnormality as the underlying mechanism for FD. Why? The stomach motility refers to the contraction of the small muscle of the stomach. You know, each part of the stomach has a unique function to perform indigestion when the stomach motility is not appropriate for its specific function indigestion. In conclusion, symptoms such as epigastric pain and postprandial fullness, syndromes, abdominal pain, bloating, nausea, and vomiting. The stomach should function properly without any limitation. When there are a limitation in the motility motion of the stomach, this can create change in dysfunctional impairment of the organ itself and to any related structures. The consequence, limitation of its motility, no matter how small, impairing motion can create irritation, visceral spasm, and many things such as dysmotility, tension, inflammation, visceral hypersensitivity, emotional distress, and so on. And number two, the visceral, because the visceral hypersensitivity. Studies have.
Mr. Arisandy, sorry,
Yes?
Mr. Arisandy, sorry to
Yes?
interrupt. We can't really hear your voice clearly. Can we just have the volume slightly higher?
Yeah. Wait. My voice not clear?
Yes, yes.
Okay, wait.
Thank you.
Okay, today clear? Hello?
Yes, yes.
Today clear my voice?
At the moment, yes, I can, but maybe yes. Can we just continue? After that, if there is any problem, I will notify you.
Okay,
Thank
okay.
you.
Thank you, okay. The pathology of FD, number two, because the visceral hypersensitivity. You know, the visceral hypersensitivity, the studies have shown the hypersensitivity associated with gastric distension, spasm, gastric acid, and bile. Visceral hypersensitivity is also associated with the development of FD, especially gastric hypersensitivity has been shown to be due to gastric distension, okay, spasm, gastric acid, and bile. And this pathophysiology of D may be because the physiological factor. A large-scale epidemiologic study showed that in high percentage of the patient, symptoms can be aggravated by anxiety or psychological distress. And the last, wait, and the last other factor. Maybe the several other factors have been associated with symptoms of FD, including environmental, dietary factor, and lifestyle. Okay, what the gut-brain axis? You know, the stomach and the brain have connection. It's called a gut-brain axis. The gut-brain axis is named for the communication network that connect your gut and brain. These two organs are connected both the physical and the chemical and number of different ways. Number one is the vagus nerve and the nervous system. Neurons are the cell phone, the your brain and central nervous system. They tell your body how to behave. There are approximately 10 billion neurons in the human brain. Interestingly, your gut contains 50,000 million neurons, which are connected to your brain through nerve in your nervous system. The vagus nerve is one of the biggest nerves connecting your gut and the brain. It sends signals in both directions. For example, in animal study, stress inhibits the signal sent from the vagus nerve and also cause the gastrointestinal problem. Similarly, one study in the human found that the people with irritable bowel syndrome or like the functional dyspepsia have reduced the vagal tone indication and reduce the function of the vagus nerve. And secondly, communication by neurotransmitter. Your gut and the brain are also connected through chemical called neurotransmitter. Neurotransmitter produced in the brain control feeling and emotion. For example, the neurotransmitter serotonin contributes to feelings and happiness and emotions. Wait.
Mr. Arisandy,
Yes, something wrong.
can we try to remove your headset or headphone?
Yeah.
Because they still can't hear your voice loud and clear.
Yeah, something on my, okay.
It's okay,
It's
it's okay.
good? It's okay? Okay.
Yes, can we have you talking without your headphone?
Yeah. Yes. It's good today? Is that now?
Yes, we can see your slide.
Okay. I continue that. The neurotransmitter, the neurotransmitter produced in the brain control the feeling and emotion. For example, the neurotransmitter serotonin contribute to feeling of happiness and also help control the body. This connection goes both way. A troubled stomach can send signal to the brain, just as the troubled brain can send signal to the gut and vice versa. So we can see the symptoms functional dyspepsia. How is the pathology occur for stomach? We can see this the gut-brain axis dysfunction. Before I explain how the pathology occur in the stomach, and the stomach they have problem for the motility and the sensory and motor dysfunction, and we can see what's the problem, the FD, the epigastric burning, epigastric pain, syndrome, portal fullness, and the early satiety. And what are the consequences? What are the consequences of FD? When you have problem with FD, you may anxious. Maybe you feel be irritable or depressed and fatigue. Maybe you feel fatigue or low on energy throughout the day. Maybe your concentration, your memory have problem or difficult concentration and the struggle at the work, school, and or in the relationship. How coexistence of diagnosis? Do confirmation of the diagnosis of FD based on number one, we must the typical symptoms of the patient history. It is very important for the physical therapy for use examination, physical examination and assessment. We must know the signs and symptoms of the FD and what is the problem for the physical and mental health. And number two, we must do the exclusion of the other diseases with similar FD, like IBS or irritable bowel syndrome, and the colon disease, or the liver disease. We must exclusion of the other disease. What are the complications of FD? Over time, the chronic FD can negatively affect your physical and the mental health. For condition can contribute your maybe your weight loss because you have problem with your stomach. You can you have an impact of if anything, and maybe you have high blood pressure because you quality of sleep disturbance. You know, you sleep very little, the time to good sleep and quality of life, and maybe you have the mood disorders. And sometimes, if
Mr. Arisandy,
yes,
sorry to interrupt once again, but it seems like we still can't hear you loud and clear. Can I suggest something? Pak Arisandy, bisa nggak kalau dibuka handphonenya, headphonenya gitu? Kalau diguna
okay,
mikrofon direct dari dari laptop, bisa nggak?
start,
Bisa dicuba?
okay,
Mungkin Pak
is it
Arisandy boleh
clear?
cuba, ya mungkin boleh cuba sekali lagi untuk diterangkan slide ini tanpa menggunakan headphone. Terima
Okay,
kasih.
okay, okay. Now my voice is clear or no?
I can hear your voice, but yes, we can proceed, and then if any problem, I will notify you again. Sorry to interrupt, Pak Arisandy.
Okay, okay, maybe my connection unstable. I don't know why.
It's okay. Yes, please, Mr. Arisandy. If any problem, I will notify you again.
Yeah,
Terima
I
kasih
think,
ya, Pak.
yeah, maaf, terima kasih, maaf.
Nggak apa-apa.
Okay, I was continue. What's the complication of FD? Sometimes if the FD very severity, maybe you can feel the headache and migraine. You know why? Because connection the brain and the gut problems by nervous vagus nerve or autonomous nervous system. Okay. How is FT managed of treat by visceral manipulation physiotherapy? Before I explain, we must know what is the visceral manipulation physiotherapy to get caught the problem in the visceral disease. What is the visceral manipulation physiotherapy? Visceral manipulation is a physiotherapy technique used to improve the functioning of the organ motility, the system internal organ function, and the structural integrity of the body, either directly or indirectly. So, what is the concept of the visceral manipulation physiotherapy? In kinesiology, of visceral manipulation, the internal organs have movement, namely motility. Before I explain the stomach motility and how is the stomach motility is a problem, you all the organ, maybe you have the problem, you know, and the movement help the organ to accomplish the different functions such as digestion, circulation, immunity, hormonal production, and homeostasis. So, when the motility organ doesn't work as well as it should, it creates tension, irritation, adhesive, spasm, pain, and organ dysfunction. Is the core concept of visceral manipulation physiotherapy. As movement specialists, the physiotherapists must know the movement of the organ. The visceral in optimal health depends on the physiology of movement. Are the organs moving? Yes, they all move, but at different speed, in various directions and with variable timing. You can see this slide. We can see the slide. How is the every organ moving? The heart, spiral cycle movement, and the lung, upper lobus, and lower lobus. You know, when with the inspiration, the lung can move the lateral and posterior, and back to medial line when we the expiration send the life up. When with the inspiration, the life can move to downward and back to upward when you expiration. Send the stomach. When you inspiration, the stomach move it to upright and anterior, and then back to lateral and posterior when you expiration. And the sun send their small intestine, and the colon, and the uterus, and the bladder. When you inspiration, the bladder and the uterus moving to anterior and back to posterior when you expiration. For the stomach, we can see how is the stomach moving simultaneously. The stomach has the three plane, frontal plane, when the stomach moving the downward when you inspiration and back upside upward when you expiration. In the sagittal plane, the motility of the stomach, it moves to anterior in the sagittal plane, to anterior when you inspiration, and then back to posterior when you expiration. In the transversal plane, the motility of the stomach when you inspiration, it can move the medial and the back to posterior when you expiration. It's very important for physical therapists because before I say the physical therapist is the movement specialist and the organ have movement. It's the namely motility. It's the head problem, physical and mental, it's the F of the problem. How is physical therapy to assessment perform the active condition? We can see the questionnaire short form that's dyspepsia for functional status of the FD. We can see the indignation, the heartburn, regurgitation, nausea is the feeling of sadness without actually being sick. And you can list there is the problem. What's the problem? Not all or once a day or more. And same this. You can list there. Not all or once a day or more. And all the problem you can list from the questionnaire. Okay. How is physical examination PT performed for FD condition? Before visceral manipulation physiotherapy performed to FD condition, we must to make examination, physical examination. There is I give the 3 examples to test what's the problem area in the abdominal of the stomach. Is namely the rebound test. You can see how the physical therapist can depress the abdomen to see and feel what's the problem area and what to feel the patient. And secondly, there's a hemodynamic test. You can feel what's the problem area and you can feel the pulse and the hand for the hand of the patient. If the post patient, if you feel down, maybe the problem for this area in the abdomen. And take the local listening test. You can press the problem area in the abdomen to know where's the problem, from liver or from stomach, from stomach. Okay, how is visceral manipulation physiotherapy performed for FD conditions? After we know the movement of the stomach, sagittal plane, frontal plane, and the transversal plane, is the physiology movement. Physiotherapists use two treatment for the stomach problem. We can see how the physical therapists move the stomach in the transversal plane. We have if see the problem, the stomach motion and the medial problem, and the transversal plane can directly to stomach to move, and the sagittal plane where the physiotherapist can move the stomach medial, anterior and posterior, like that, and the frontal plane where the physiotherapist can move the stomach to the third one and back to upward. This very specific technique for a stomach, and too much technique for the visceral manipulation. Too much technique for the visceral manipulation, for the liver, for the kidney, for the pancreas, for the heart, for the colon, for the bladder, for the gallbladder, for the lungs, and other internal organs. They have the specific technique in the visceral manipulation physiotherapy. And the visceral manipulation physiotherapy, you can use the technique with long leg level. You can use the long leg level and the long arm level. You can use this technique for the stomach problem, and the stretching of the lesser omentum in the stomach. If you know, it's the problem of the lesser omentum. You know that have the lesser omentum is the problem. Okay, effect of how is effect of visceral manipulation physiotherapy? I give this for the effect of visceral manipulation physiotherapy. There is mechanical effect, psychological effect, neuropsychological effect, and biochemical effect. Mechanical effect, the passive movement of the visceral manipulation in the internal organ and the connective tissue and the surrounding muscular, as well as breaking adhesion of the realigning the scar tissue. led to increased visceral motility and decreased pain with motion. And the neurophysiological effect, the visceral manipulation, has been proven to have both local and central nervous system effect, and is believed to be the most predominant effect, which leads to local and global pain inhibition, autonomic nervous system facilitation, muscle spasm inhibition, and improved positional awareness by proprioception, and the biochemical effect the nervous system by releasing the body's natural pain, relieving opiate, and both the local and the central levels, helping to reduce pain and they allow normal visceral movement to occur. And the last, the psychological effect. We know the hands-on treatment of physiotherapies has a very strong effect on patient outcomes, especially if the patient expects the treatment will help. The visceral manipulation approach can help patients reduce the fear associated with their pain by demonstrating a logical cause for their pain and often they quickly change their symptoms. So we can see this research about the effect of visceral manipulation on the diastasis of the knees. This one, the example, how visceral manipulation performed, and we can see the adhesive. Why the stomach motility or the another organs can be limitation. You can see the addition is the addition to make the problem for movement in the internal organ. The example is you can see the column. What the problem is the vowel addition, and the second picture you can see addition for the liver and the one abdominal inside. You can see this. This is the addition to make the liver can move to optimal, and the picture, the omental addition, the liver and the diaphragm. You can see the omental addition can the internal organ limitation. It can be the limitation like that. As this research by Randy physiotherapy. Okay, this another journal. I said we can see the treatment, the visceral manipulation for musculoskeletal disorder, for neuromuscular disorder, and the visceral problem itself. And for pediatric research, you can use the visceral manipulation for the handling the problem for musculoskeletal, neuromuscular, cardiopulmonal, and pediatric also. You can see how is the visceral manipulation can perform for the low back pain and visceral dysfunction and gastroesophageal reflux. All the physical therapy, we can see all the physical therapy. Okay, what is the fifth the set of visceral manipulation physiotherapy technique? We can use the frequency 3 times with intensity 7 to 8 cycles per plan, or 21 to 28 cycles per 3 plan with gentle pressure, and the time 20 to 30 minutes, and the 5 the stomach mobilization directly and indirectly. This defeats the set for visceral manipulation PT technique. And this I give the demonstration in my video how is visceral manipulation physiotherapy performed for general organ, internal organs. Okay, we can see. This technique for column, this technique for column, visceral manipulation for column. And this technique for stimulation the autonomic nervous system, especially the sympathetic nervous system. Same this technique. And this technique for the lung mobilization. This for bronchus mobilization and bronchioles. If the patient have the problem with the inspiration and expiration, and this technique for the spleen. If the patient have problem with the spleen, we can use this technique. Okay. And this is my reference, and terima kasih. And any question? Finish up for presentation for me.
Thank you, Mr. Arisandy. That was a very interesting topic.
30 menit.
Terima kasih Pak, begitu informatif sekali. Kita ada soalan ya Pak, sebentar ya. With questions.
Maybe I can mix English and Indonesian language. No problem?
Yes, sir.
Okay.
Yes,
Thank
sir.
you. Terima kasih.
Sama-sama. Okay, we have one question from Yulita Safira. In another condition, can patient with functional dyspepsia to direct access to physiotherapy? Mungkin jika Yulita, is it okay if you can ask directly to Mr. Arisandy as well?
Okay.
In another condition, can patient with functional dyspepsia to direct access to physiotherapy? I assume can patients with functional dyspepsia have direct access to physiotherapy? Hopefully Yulita can respond. Is this what do you mean?
What's the question? I not clear for question.
Okay Pak, soalannya ya berbunyi
Ya, kurang
in
dengar saya.
another condition, can patient with functional dyspepsia have direct access to physiotherapy? Gimana keadaannya jika pesakit functional dyspepsia boleh mempunyai direct access ke fisioterapi Pak?
Okay. Thank you for the question. The visceral manipulation, memang they have two technique, directly and indirectly, secara langsung dan tidak langsung. Directly visceral manipulation, if the physiotherapist removing the stomach directly, artinya fisioterapi menggerakkan langsung organ tersebut, is the directly visceral manipulation. And the indirectly visceral manipulation is the physiotherapist can another technique of visceral manipulation to stimulate the autonomic nervous system. Artinya, ketika fisioterapi menggunakan teknik lain dari visceral manipulasi dengan memfasilitasi sistem saraf simpatis dan atau parasimpatis melalui teknik fasilitasi kolumna vertebralis. Seperti itu. Jadi fisioterapi can choose the two techniques, directly or indirectly technique. I think so. I think like that. Thank you.
Okay, thank you, Mr. Arisandy. We go to the next questions. Do you have any plan to conduct a workshop for visceral manipulation technique in Malaysia after pandemic, Mr. Arisandy?
Inshallah, I will.
InsyaAllah. Soalan seterusnya ya Pak. Could be this technique is applied to those who has scoliosis. Bisa nggak sekiranya digunakan untuk pesakit yang ada scoliosis Pak? I think Mr. Arisandy is having connection problem. So please bear for a while. Ya Pak.
Ya.
Masih ada Pak.
Okay.
Okay, soalannya tadi. It's okay. Soalannya tadi, adakah teknik visceral manipulation ini sesuai digunakan untuk pesakit scoliosis Pak?
Ada. Indirectly technique.
So it is yes.
Yes.
Visceral manipulations can be used
Yes.
for patients with scoliosis. Yeah.
Yes. We can use the visceral manipulation. The visceral manipulation not only internal, especially the internal organ, but the other soft tissue and the joint, like that. Thank you.
Thank you, Mr. Arisandy. And we have one more question here. Can physiotherapists handling the migraine or vertigo in the FD condition only with visceral manipulation physiotherapy? Bolehkah migraine atau vertigo pada pesakit yang ada FD condition dengan menggunakan visceral manipulation physiotherapy? Bolehkah?
Yes, it can. The visceral manipulation can be used for the vertigo or migraine with the FD. But mungkin kita combine with the another treatment like the cranial manipulation or the myofascial release or the exercises for the vertigo and migraine, like that. Thank you.
Okay, Mr. Arisandy, kita ada lagi 2 soalan ya.
Yeah.
Does the patient needs to control the breathing while you are performing the visceral manipulation technique? Adakah perlu dikontrol pernafasannya? Pesakit perlu mengontrol pernafasan semasa melakukan visceral manipulation technique?
The visceral manipulation can combine the inspiration and expiration. Harus dikombinasi dengan pernapasan. Karena dengan pernapasan akan membantu organ cepat bergerak lebih baik. Seperti itu. Thank you.
Soalan yang terakhir, Mr. Arisandy, do you think the stomach manipulation is safe for someone with hiatal hernia? Adakah stomach manipulasi selamat untuk seseorang pesakit yang mempunyai hernia, hiatal hernia? Saya ulang ya Pak. Do you think the stomach manipulation is safe for someone with hernia?
Hernia.
Yes, hiatal hernia. Adakah selamat untuk dilakukan manipulasi?
Yeah. We can do it, the visceral manipulation. Because the visceral manipulation, before I said, too much technique. Not only for internal organ, but for the muscle, for the joint, for the brain, for the heart, and other soft tissue, like that. Thank you.